I'm going to invite you one more time, Tammy. We'll see if it works. Are you there? There
Hello!
you are. Oh my gosh, we have matching glasses.
Yes, we do.
I love
Great,
it.
great minds think alike.
I guess so. I'm going to turn my volume up. Well, thank you so much for joining us.
Thank you for having me.
Yeah, this is great. So I'm just going to quickly introduce, you and all the amazing things you're doing, and then I'm just going to ask you a few questions if that's okay.
Okay, sounds great.
Awesome. So, as I mentioned, Tammy is a registered nurse living in Scottsdale, Arizona, has a Bachelor of Science in Nursing from Grand Canyon University. She is the president and founder of Cooking on the Veg and Wellness. So, everyone just needs to follow her right now. And she specializes in plant-based cooking and nutrition classes, culinary medicine, health coaching, and lifestyle medicine. She is a Food for Life instructor for the Physician Committee for Responsible Medicine. You teach a plant-based cooking series with classes that focus on cancer, diabetes, hormone balance, kickstarting health, and you're the lead chair for and presenter for PPOD, Plant-Based Prevention of Disease Conference in 2021. And you're on their board of directors. Tammy volunteers her time and works with those in underserved and underrepresented communities for achieving health equity and improving chronic disease. Oh my God, you're doing so much good work. She is part of the Seeds to Inspire Foundation and serves as the Community Nutrition Program Development and Facilitation Lead. She's also a nutrition content expert for the Native Food for Life online program with the Physicians Committee for Responsible Medicine. I don't know how you have time to do all of this, but it's amazing. You're a member of ACLM, the American College of Lifestyle Medicine, and a graduate of the T. Colin Campbell Center for Nutrition Studies, certified in plant-based nutrition. And you've been on the Exam Room Live, one of my most favorite podcasts. And you are a PCRM Nurses Nutrition Network. You're the co-chair for that organization. And you are a featured Food for Life cook on the show So Many Cooks in the Kitchen, which I love that show. My friend Cody is also on there, our mutual friend, I should say. And her daughters are on there often. I love it.
Mm-hmm.
Anyway, and you're the co-founder of the annual holiday vegan Thanksgiving Moss cooking program. Oh my gosh. And that's probably right around the corner, right?
Yeah, indeed.
Anyway, well, thank you so much for joining us on Divinity. Tell us a little bit about your own personal journey in going plant-based and how you got involved in all of this.
Yeah, so my plant-based journey kind of started a little bit by accident, kind of fell into it a little bit. I started off my nursing career working in a level one trauma hospital here in the Valley.
Oh,
And then I switched to a level 2 trauma, and I worked in their ortho trauma unit.
okay.
And I worked there for many years, the very bedside nursing, we got to hand it off to those bedside nurses that work in the acute care setting. They're doing such an amazing job. My hat's off to all of you working in healthcare, whether you are a doctor, nurse, physician's assistant, if you work in, working to clean things up, if you work in the cafeteria. Thank everybody in the hospital setting for all that you do, because you've been doing some amazing work. I got kind of disillusioned with the way that, on the one hand, technology, right, is wonderful. We have the best technology in the world here in the West, and especially in the United States. If I go out, get hit by a bus, they've got the technology to go and put me back together. However, the part that I became disillusioned with, it was the part where how we basically treat chronic disease, right?
Right.
And so it was like a pill for every ill. It was a pill procedure. If you've got whatever's going on, it was a pill or procedure, which, as we know, as healthcare workers, you don't develop a chronic disease because you're not undergoing a procedure. You don't develop a chronic disease because you're not taking a pill. So how can that really address the root cause of your chronic disease? So that's where I became a little disillusioned, and I decided to venture out and leave the acute care or hospital setting. And I decided to go into an integrative oncology practice. And then when I went into the integrative oncology practice, I learned that all of the patients there were raw vegan. And I was like, first of all, what is raw vegan? And what does vegan have to do anything with anything whatsoever? And so I found out in order to be a better nurse with them, I started to develop and really research the link between chronic disease and specifically oncology or cancer, right? And my whole world was opened up to things that I didn't know, things that were not taught in nursing school, not even brushed upon. I mean, the only kind of basic nutrition we get is how to deal with patients with deficiencies, right? Like beriberi and scurvy, which no one has anymore. Or
of course, right? It's those rare nutrient deficiencies that
exactly. And so that's all that we basically got, and then, things on how the body works and what goes on inside the cell and the Krebs and all that, Krebs cycle.
Explains why in healthcare, we don't see most medical providers recommending plant-based eating and stuff because they're like, well, we didn't really learn about it, right? Sorry.
Right.
Yeah.
Yeah. So we didn't totally learn. So I started reading, the first book I read was The China Study by Dr. T. Colin Campbell. And then I just went down and continued my education, my self-education from there. And one day my husband and I, on a weekend, it was Labor Day weekend, 8 years ago, 9 years ago, not 8 years ago, that we just literally spent an entire weekend watching documentaries on, from forks over knives to, what animal agriculture is doing to the planet and, of course, the animals.
Yeah.
And there were things that, that I learned about that I will never forget, some things that I saw that unfortunately I will never forget either. But it was really at the end of that weekend, that Labor Day weekend, I called up all my friends and I said, that Monday of Labor Day, and I said, listen, all this stuff is going in the bin if you guys don't come and get it. We literally cleaned out the fridge, the freezer, the pantry, got all the animal products out, even our little chihuahua, our little 6-pound chihuahua. And we're like, that's it. We're getting, we're going to do this 100%. And for us, it was just like, when you know better, you can do better. And it was just, we just ripped off the Band-Aid. We're like, well, this is kind of a little silly to continue to try, to continue to feed kind of the risk of developing chronic disease. So that's it. We're done. We were done. And we haven't been back since.
You just completely went cold turkey, flipped it.
Yep.
And
us and my little chihuahua, she's got, she eats vegan kibble, and
that's good. So does my dog.
Yep, the whole family.
Did you find also that, I mean, how quickly did you feel better, or did you feel better, or did you notice?
Yeah, because, I was one of these people, if you had told me like 10 years ago that I would be right here, right now, doing what I'm doing, I would have laughed, because I was a person who I was just like bacon, bacon, bacon. Everything's better with bacon, bacon martinis, bacon, bacon on the weekends. We'd go out to eat, and my husband would be like, oh, I don't want any of this. And I was like, you order the bacon, I'll eat my bacon and your bacon. It was just completely oh my gosh. It was like, my friends joke about it. They were like, but you love bacon. And I was just like, now it's just a completely different, completely different. And so, it was just having that kind of epiphany that just really put us kind of over.
Sure. Oh my gosh. Well, that's amazing. And I love that story too. And mine too. I mean, I remember we watched a documentary, we watched Forks Over Knives. And the first book we read was Eat to Live by Joel Fuhrman. And kind of like that for us too. We just flipped it right over. We're like, okay, we're going to do this. And it was, and it's all behind us now, and the rest is history, which is amazing. But you mentioned thanking the hospital workers, which, it's been such a difficult past couple of years, right, with COVID-19. And we know that that marginalized groups of people and some ethnic and minority groups have been disproportionately affected by COVID-19 for a variety of reasons, right? And we know that those that suffer chronic lifestyle diseases, like we mentioned, obesity and diabetes and heart disease, are at higher risk for poorer outcomes. And we're kind of starting to see some literature emerging around nutrition. And you know, we're currently working on this other study that I know you're helping us out with. But why is tell me a little bit first about your health equity work and why this work is important, and why is nutrition not being discussed more sort of at the policy level?
Yeah, so I think, I do work with BIPOC populations, so that's Black and Indigenous people of color. And so we know that COVID is really within that, within those parameters, has just like decimated those populations in comparison to the majority, right? And that they suffer a lot more increased hospitalization rates. They have they're overrepresented in chronic disease and underrepresented in so many other, in so many other areas. And so we know that the risks are higher because the rates of chronic disease are higher, whether it's obesity or diabetes, or if you put them together. I don't know who coined the term diabesity.
Okay. Yeah.
And, high blood pressure and high cholesterol, heart problems, certain types of, chronic kidney disease, and all of these things that really put people kind of up and over the edge as far as their risk is concerned. So that's why, at least here, I really wanted, and as many, rings as I can throw my hat into, is to really address these health disparities. Like, what is the misconnect between these chronic diseases and COVID? And I think that the misconnect, it all boils down to education. There's just no ways about it. I mean, we have to get this information out there. And as you said, and I kind of hinted as well, this is stuff that healthcare providers just don't know. They really don't know any of this information. And when I found out the information, I was kind of mad, I have to say, that I'm like, hey, why didn't we learn about the power of nutrition in nursing school? That's right. We tell people the status quo, eat healthy. What does that actually mean? Like, what does actually eating healthy mean? Before, like, what are some of the benefits that we got? We became much more regular. We don't have any more of those log jams that we used to have. That's the first thing. That keeps moving smoothly.
All that fiber only found in plants, right?
Exactly. Fiber, it is not found in animal products.
That's right.
And so that was one of the first things that that was an advantage. But also, like, I didn't have bad skin before, but just my skin kind of had this magic glow to it, my energy. And these are things that people, and I didn't, necessarily, my husband and I didn't need to lose any weight, but these are some things that people need to know that a plant-based diet can do for you. And they also need to know that link between their chronic disease and food. And then that, it's specifically with COVID, because there is definitely that chasm, right? That in between, the majority, how they deal with what their COVID stats are, and the minority groups, what their COVID stats are. So that's why I think it's so important, because until this information gets out, until the information gets out, until we can educate our healthcare providers, until we can educate the people in these minority groups, and actually everybody.
Right.
There's going to be, and there's been, I think, fortunately, a bigger focus now on food, now that people are kind of realizing with the pandemic, hey, what does matter?
Yeah, I think that's true. I think you have to empower people to make those changes and and getting them educated. Just like you said, we have to get the information to the people. And unfortunately, there are barriers, right? Like structural racism and social determinants of health that all affect people's health as well, and those need to be really addressed at the policy level. So I think one research study at a time, and all of us continuing to do all the amazing work that you're doing, and really trying to get to these communities is key. So,
Mhm.
oh, you're helping us out with Project Gaia, and you're posting.
Yeah.
You put the bio for this survey that we're trying to just get another research study in the, to look at the relationship between dietary pattern and COVID-19. So, thank you for posting that. So, if you have one thing, so I'm just, if you could tell anybody that's watching this just one thing that maybe they could do today to improve their health, improve their life, one step they could take, what would that be?
Ooh, that's a great question. I I would say that there's something that is called the crowd out method. So the crowd out method is instead of just like, ripping the band-aid off, kind of like you and I did, most people kind of take their time, and it's a journey, and we're both still on that journey. There's always room for improvement, and we're not talking about perfection, right? But to add those fabulous four is what I call it. They're fruits, vegetables, whole grains, legumes. Add those fabulous four, add more of those to your plate, and then you kind of crowd out gradually those other foods that are problematic for chronic, for chronic diseases, most mainly, animal products, secretions from animal products like dairy and seafood products. And so the more of those foods that you can crowd out,
Yeah,
the healthier your plate will eventually become, and keep adding more and more and more. And pretty soon you'll be there. You'll be, plant powered and going strong.
I love that. And that's something easy people can do. Crowd out the bad with the good. I love it. All right.
Yeah.
Well, last question, I guess. Tell everybody where they can find you, how they can follow you.
Yes. Yeah. So I am here on Instagram and Cooking on the Veg. I'm also on Facebook, Cooking on the Veg, Health and Wellness. I also have Robertson Health and Wellness, both on Instagram as well as Facebook. And yes, that's where I can be found. I offer plant-based nutrition classes. As you said, I'm a certified food for life instructor.
Yes.
So next month, we just finished up breast cancer prevention. And then next month, we are on to diabetes. It's National Diabetes Month. So I've got some classes for that. And I just want to tell you, Erin, I am so honored to be a part of this research, to bring this information, get this, the research that is needed, because again, as you said, there's some interesting research that's out there right now. And we know how that's affecting, those research subjects are basically the majority, done on Caucasian men, from the British Medical Journal.
Yeah.
And there is that link there. There is that link. And I think this information from this project that you are heading is just so important, as to get more information about how this affects the BIPOC,
Exactly.
Black, Indigenous, people of color. And that's everybody. And so I'm so honored to be a part of that, and Project Gaia. And please, everybody, go to my bio, hit that link for that survey. You are really saving lives and helping to get the research that is badly needed, to find out the connection between food and COVID-19. I thank you so much in advance, everyone, for filling that survey out. It's going to do a world of good.
Thank you. Thank you. Oh my gosh. And thank you for taking time out of your very, very busy day, I'm sure, to talk to us at Divinity. And yeah, that's it. All right. And everybody,
Awesome.
okay. Yes. Thank you. All right.
Thank,
Take care.
thank you.
All right. Bye-bye.
Bye.